right, good afternoon again to everybody. So I'll be presenting on the overview of implementation science. And our presentation is going to adopt this outline from what is implementation science right up to some examples and conclusion. So by the end of this presentation, we should be able to define what implementation science is and also explain why it matters in public health. We should be able to identify and describe key terms used in implementation science, understand the major component of implementation science, and then be able to differentiate between implementation science and clinical research. And also we'll have some practical examples where we can identify implementation science in it. So what we have here is actually a picture of where we are. So the goal is to close the gap between what needs to be done or what researchers have gotten from research and what is actually done. So in today's world, we have a lot of people who carry out research, and most of this research just ends at the level of publications, or many of us even have not published our thesis or have been writing things. And then you notice that there's a lot of research that has been done, but then no change is being done. No change occurs in our community. The same thing over and over again. And then there's a question of who is responsible for disseminating the information that we have from the research we have conducted. Everybody shifts the blame to the other person, the researcher to the policy makers to public health practitioners. And then everybody thinks that dissemination lies somewhere else and is not their part to play. So in reality, what actually works? Averagely, it takes 17 years to turn 14% of the research that has been conducted into practice. So we understand that there is a huge gap that exists between what we know, that is the research that has been conducted, and actually what is done in real life. And then we need implementation science to be able to bridge this gap so that all of what we know, we're able to put it into practice effectively. So imagine how long it's going to take if 17 years is equivalent to 14%. How long is it going to take if we want to get as close as 70% or 80%? Maybe some of us will not even be alive to see when all of that will take place. But with implementation science, it's supposed to be easier. So we are going to have a scenario. So we know that when a mosquito parasite is infected into the human, you suffer from malaria. And according to statistics, you have at least 3 in 10 people affected with malaria. So what works? We know that when also you sleep under a mosquito net, it reduces the malaria infection rate. And then in order for us to get to this point of getting people to sleep under the mosquito net, we think that by doing door-to-door delivery of mosquito net or taking the net to the people that need it the most, they are going to be able to use it. But in reality, that is not what happens. Most of these people in reality, this is what they tend to mosquito nets. They use it for farming, agriculture, and for purposes that were not intended. So you can be asking them, are you using your mosquito net? They'll tell you yes. In real sense, they're actually using it, but they're not using it for the purpose that it was intended for. So this is where implementation science comes in. It enables us to be able to know what works, where, and why. So we can define it as the study of methods that promotes the adoption and integration of evidence-based interventions and practices into routine health practice. So this concept of implementation science was actually born out of the desire to address challenges associated with the use of research to improve health. So there's a lot of research that is being done, but then the health conditions or some health conditions remain the same. People will discover things and then they don't implement it, leaving us in the same place that we were. So there's a huge gap between knowing what has to be done and actually doing what has to be done. So implementation science is the concept that bridges this gap. It closes the gap, that's the no-do gap. And in synonyms, we have words that people always use to imply to implementation science. You have words like uptake, diffusion, elimination, action to knowledge, research utilization, knowledge transfer. All of these words actually mean different things, and we are going to be looking at them in the course of our lesson. So implementation science seeks to understand what works in a real world situation or what works in our usual practice or in our usual setting. And also it also helps at addressing how, why, and what is implemented and the effect it has on the people. It has concerns with interventions at several levels. How can we implement um, at the level of policymakers, at the level of the individuals, at the level of the programs? And also it has the intention to improve health and access to health services and also improve the quality of health services that we are getting in our society. The main characteristics of implementation research, we have content specific. When we talk about content specific, it's the fact that it has to be adapted to suit a unique culture, economical background, political setting, or even an institutional context in which the intervention is being implemented. And also it's demand driven. Usually it responds to specific needs expressed by the people of the community or the policymakers or the researchers themselves. So you want to be able to conduct implementation science or implementation research to meet a particular need of the people in the community. Also involves a lot of stakeholders and a lot of sectors. So you say it's sectorial and also multi-stakeholders are involved. It cuts across all areas of life. It could be health, it could be governance, it could be politics, everything, and everybody is involved, from the community members right up to the funders and even the chiefs. And also implementation science needs to be implemented in a real world setting. A real world setting is just about where we find ourselves, where we live, what we do, the things we do in our day-to-day life. That's environments that have not been controlled. And it also enhances the validity and the applicability of our findings, because once we're able to get to the point where we're implementing an intervention based on what we do on a day-to-day life, it's easy for people to adopt the intervention. And also it focuses equally on process and outcome. It values how an intervention is implemented and also the results that come out as a result of the intervention that is being implemented. So the focus is not only on what works, but also on what works and for who and under what condition it works. So why does implementation science matter? Why are we studying this concept in public health? We have already established the fact that there's a huge gap between what we know and actually what is done. So implementation science helps us to be able to close this know-do gap. And also it's science to service. From what we have been able to discover in the course of our research and everything, and um, it helps you to be able to scoop your intervention, like really draft your intervention in a way that is going to fit in the area where you want to implement your intervention. It also provides evidence for policymakers to be able to implement interventions, to be able to come up with policy drafts, and also they are used in refining theories, in the sense that theories, as we are going to look further, they are the main aspect when it comes to implementing implementation science projects. And sometimes a theory might work and it may not work. So depending on how it works in a particular area or context, it enables you to be able to know how to better adopt that theory to suit your context in the next time you want to implement an intervention. So we're going to be looking at key terms. We have implementation research. We cannot talk about implementation science without talking about implementation research. And usually a lot of people get confused between both concepts. But you know that the broader picture is the implementation science, and then implementation research is a part of it, the sub part of it. So this refers to the scientific study of methods and strategies that promote the adoption, integration, sustainability of evidence-based interventions in a real-world setting. So it asks the question to understand what works best. For example, we gave a situation of a community where they use the ITNs for farming. So we want to understand why these people use ITNs for farming instead of using it for the purpose for which it was intended. There are many reasons. Many of them may not even be aware that they are supposed to use the net otherwise. Maybe they have had exposure to wrong information on how to use it. They have a lot of stereotypes concerning the use of this nest, but you want to be able to understand the why. Why do they do that? That's where implementation research comes in. And in addition to implementation research, we have implementation practice. Is the application of evidence from implementation science to be able to meet the needs of a specific context, pardon. So we know that these people don't use mosquito nets. We have understood why they don't use mosquito nets, and now we want to be able to ensure that they actually use the mosquito nets. That's where implementation practice come in. So these are the things we are going to do that are going to enable them use the mosquito nets to reduce malaria cases. We also have other definitions like operational research, intervention research, implementation research, which you have seen, health system research, and effectiveness research. So all of these forms like a backbone of implementation science. And they are very important when you want to talk about um, implementation as a whole. We have implementation, which is described as a process of putting to use or integrating the evidence-based interventions into practice. So we have something we want to put, we have an intervention we want to put into practice. That's we want to promote the use of mosquito nets. That is what we are doing. So the process of promoting the use of mosquito nets is what we actually call the implementation process. And this is done in a planned manner through collaborations. You have to collaborate with the community, that's the stakeholders, and it has to be adapted to the setting. We spoke about real world situations, mean that the situations in which we live, we do every other thing. That's an uncontrolled environment. And these settings differ for different people. With what works in a different setting may not certainly be what will work in another setting. So we have to make sure that we are adapting our implementation process into the setting in which we find ourselves. That's taking into account cultural aspects, political aspects, religious aspects, and everything that we see that can be a hindrance to our implementation. And this implementation is guided by implementation strategies, which we're going to we're going to see in the slides ahead. It's also informed by evidence-based intervention. So the implementation we are doing is based on the what that's the subject of implementation, that's the evidence-based intervention. It's supported by the implementation team, that's all the stakeholders being involved. And also the implementation process is routinely evaluated to be able to know what to improve on, like an evaluation, normal a routine evaluation process that you have, midterm evaluation, um, and end of project evaluation. So we have implementation, we also have de-implementation, which is usually the most difficult part. It's easy to implement something, but when it comes to a concept that people already have stereotypes about things that they have been doing for a long time, and then you want to take them out of that process, it's usually very difficult. We take, for example, the people that use their mosquito net for farming. If you want to start telling them that that's not the right way to use it, they'll start saying, oh, their forefathers used to do like that, their great grandmothers taught them that that is what they're going to do. And it's discovered that it becomes very difficult to actually take them from what they are doing to what they are supposed to do. So the implementation process, which sometimes is necessary because not everything that is being implemented is the right thing. So it's the removal or the replacement of an ineffective, untested, a harmful or inappropriate health service. In this case, we have the inappropriate use of ITNs. Sometimes you have to de-implement a project because it has been proven to be ineffective. there's a lot of data or there are a lot of studies that will say that it has this process is not effective in prevention of malaria. So instead of spending resources, time, and energy implementing that process, we rather do the implementation of the process. Also, if there's a lot of contradictory data concerning the process, then it has to be de-implemented. And if it has been untested, where there's little or no empirical evidence to prove the effectiveness of the intervention, then we have to de-implement it. We also have the concept of knowledge translation. That's the set of activities involved in putting research outputs into practical use. That's as simple as it sounds. And then dissemination. We have conducted our research, we have our findings, and now we want to we want to relay our findings to a specific audience. So this depends on our target population. Sometimes we can have it in form of a policy brief. We can have it in form of a policy brief. That's if you are targeting the policymakers. Community meetings. Maybe we carried out a research in a community where the use of mosquito nets was low. We're going to be using mosquito nets throughout that example. You pardon me. And then you want to tell these people that this is what you found out during the study. You can organize a community meeting where all of these people come and then you tell them that this is what you found out during your study. You also have in the form of publications through articles, which is most common, especially for researchers. So we're going to the concept of implementation science. When we talk about implementation science, we want to look at it into the categories of the what, the how, and the where. So when we talk about the what, that's the component of the intervention itself. That's the evidence-based intervention, which we're going to be looking at in details. We'll talk about the how, refers mostly to the processes in which we use to integrate the intervention into practice in our setting. And when we talk about the where, is basically the context or the setting in which the intervention is being implemented. Um, the major characteristics of the where is it has to be an enabling environment where the people support the implementation of that project. And also it has the available resources to be able to um, maintain the implementation of that project. So breaking down all of these components, we're going to be looking at them individually, beginning with the what. Here we have the evidence-based intervention, what we call the EBIs. The EBIs are summarized into 7 Ps. There are programs, there are practices, there are principles, there are procedures, there are products, skills, or policies. These things that have been proven to be effective. In our case, we have a product, which is the mosquito net. It has been shown that use of the mosquito net effectively reduces malaria, prevents malaria, let me say, pardon. So they're referred to as the what or the element of implementation. And these elements of implementation, before they are brought about, they're grounded by a series of empirical evidence. That's through literature, through research findings, and you also have to go through a process of data analysis and experimentations to be able to know what works. That is the what, the EBI. It can be a project, it can be a policy, it can be a pill, it can be a practice. It can be a pill in the sense that we have the antiretroviral treatment, the antiretroviral regimen, the ARTs, which they use very positive patients. So just to say that an ABI can be anything that has been proven to be effective. And going forward, we have the how. So how do we put these interventions into practice? How do we implement our intervention? How do we implement our interventions? Is what we call is through the process of implementation strategies, which methods or techniques used to enhance the adoption, implementation, sustainment, and the scale up of a project of a program of practice. That's basically of the evidence intervention. It can be a program, a practice, a pill, a product, or anything. So we basically have 2 types of strategies. We have the discrete strategies where we use one action or process at a time. we use people to use the mosquito net. And then we have a multifaceted strategy where it's a combination of both or multiple discrete strategies. So in addition to the reminders, we are going to be using educational materials. So we discovered that the people use the mosquito nets the way they do because they had wrong information on how to properly use it. So instead of it, so all of these are implementation strategies to improve the use of the mosquito net. So there we have our object of implementation, that is the EBI, the mosquito net. And then we have our implementation strategies, what we are going to do to be able to make people use the mosquito net. So we actually have a framework, that is the ERIC framework, where we have close to 73 implementation strategies. I know that sometimes it's maybe inefficient to use just one implementation strategy. So you may be able to use, you may be willing to use 2 or 3 or more, so far as it works for you in that context. So how can we design or tailor our implementation strategies? First of all, we have to know what needs to be done differently and by who. We also have to know what theories, models, and frameworks we need to use. That's These theories, models, and frameworks help you to identify barriers and facilitators. And also you should be able to select the appropriate strategy and that is effective, is locally relevant, and is feasible. Also decide on how change implementation can be measured, including the causal pathway. So using each of these steps, we are going to see how we can implement our implementation. We can use our implementation strategies to improve the use of mosquito treated net. So the first example is identify what needs to be done differently and who needs to do what differently. So the problem we have identified is that there's availability of the ITNs. We saw that there was door-to-door distribution of this mosquito net, but then the use remains low, especially the target population here, the pregnant women and children under 5. So the behavior to the problem is that the people do not sleep under the mosquito net and they misuse the net for different purposes. That's for fishing, for farming. And our actors in this case are community members, our local leaders, and the frontline healthcare workers. So all these, the actors are what we can also refer to as the stakeholders, who are those involved. So the second part, which is we have to use a theoretical framework to be able to identify our barriers and facilitators, because our strategies needs to be implemented based on the barriers and facilitators that we have identified. For example, we have lack of knowledge. The people actually don't know how to use the mosquito net. We have misconceptions. They believe that sleeping under the mosquito net causes heat rash. Also, they also have the idea that only dead people use mosquito nets. Also, they don't trust their local public health programs. We have facilitators that can be the fact that they trust their healthcare workers. So if they ask them to use the mosquito net, they will use it. And we also have their strong leaderships. They believe so much in their chiefs and their other religious leaders that whatever they tell them to do, they're going to do it. And there's high demand for child and maternal health protection. So in this case, we have identified our barriers and we have identified our facilitators. So this is going to help us because what we see as barriers, we're going to take them as challenges. Okay, they lack knowledge. What are we going to do to make them have the knowledge? We're going to give out educational materials. That is an implementation strategy. You want to improve their knowledge on the use of mosquito net, so they improve on the use of mosquito net. What is a facilitator? They trust in their healthcare workers very well, mean that whatever the healthcare workers are going to do, are going to tell them they're going to do it. So now you want to leverage on this fact that they trust their healthcare workers to use the healthcare workers to do door-to-door distribution of the mosquito net. That is an implementation strategy. So for the barriers, you identify your barriers, so they help you know how to address them, and you identify your facilitators, so you use them as a leverage for your implementation. So just as I was saying, one of the barriers we had was that they had poor knowledge. So here we want to conduct educational outreach. We are going to do home visits to teach about the benefits of ITN and also how to care for their ITNs. They are going to use respected village leaders to advocate for ITN use. And then you're also going to use reminders and cues. In this case, we are assuming that it's a local context. So we're going to use town criers, the local town criers that do announcements. And we also want to be able to adopt our implementation strategies to the context, because we can come up with a strategy, but it doesn't work in the context in which we want it to work. So you should know what works well. Ensure that our trust strategies match local culture, literacy, and the resources that are available. And also the fourth point of deciding how the change will be measured. You actually have implementation outcomes, which you are going to be looking at further, how you can measure a change from the baseline information that you have. So you should have like a percentage of households that now use ITNs. You should have the community health workers that are willing to deliver the educational services, and that ensure that they are delivered the way they are intended to be. Because we can be using the community health workers as educative agents, and then they still end up passing across the wrong information. And you also want to assess the acceptability rate. That's the number of people that have finally decided to get comfortable using ITNs and have accepted using ITNs. And you should be able to come up with a causal pathway. That's community engagement, knowledge improvement, positive attitude shift, and increase in ITN use, thereby leading to a reduce in malaria incidence. So you should be able to point to the fact that the reduce in malaria incidence is as a result of your implementation strategy. Then you can say that the strategy worked for you. But if not, maybe something else was working in the background and you thought it was your implementation strategy. So you should always do this evaluation to know that the strategy is actually working how you intended for it to work. So we're coming up to the implementation outcomes. Yeah, these are like the indicators, success indicators of implementing an evidence-based intervention in a setting. And they tell how well an intervention has been integrated into practice. We actually have three categories of implementation outcomes. We have implementation outcomes, which are based directly with your implementation science or your implementation research. You have the service outcome, which are based on the services that are being provided to the end users. And then you have the health outcomes, which are based on the end user satisfaction. So improvement in the consumer's well-being provide the most important criteria for both evaluating the implementation outcome and also evaluating the implementation strategies for your EBI that has been implemented. So the goal is that at the end of the day, you should have high client satisfaction. You should have decreased mortality and mobility. So that is it. So we have some key implementation outcomes. There are actually a lot of them, but we're just going to describe a few, like acceptability. When we talk of acceptability, it means that the project is welcome, is embraced by the people it was intended for, the intervention, sorry. So it's the extent to which our stakeholders embrace the intervention that is being implemented. Then we have adoption. That's is the intention or the initial decision or the ability to be able to try out the intervention or the innovation that is being implemented. We have appropriateness, which is the perceived fit of the intervention in a setting. We also have feasibility. That's the extent to which the intervention can be used or carried out within a specific setting. We have fidelity, which is the extent to which the intervention is implemented as it's supposed to be. Sometimes we write on how it's going to be implemented, and in the field, it happens that it cannot go exactly how you've written out. So you want to suit it to match your context or your setting. But fidelity is the extent to which it's implemented as it was intended. Then we also have a very important factor, which is the cost of implementation. Because here is very important because it has to cover up for the cost of the intervention, the implementation strategies. And cost here will not only be in terms of financial enumerations. You also have time, you have resources and personnel that are available to carry out the implementation. We have penetration, which is the integration of a practice within a service setting and a subsystem. That's the extent to which people are able to use that service that has been implemented, that or integrating it into your normal routine health setting. And you have sustainability. That's the extent to which the EBI is maintained and continued even after the source of funding has been cut off, which is also the most important, because it makes no sense implementing an intervention that at the end of the day, when the project ends, then when the funding ends, the project automatically ends. You want to ensure that everything you're implementing has some sustainability aspects in it, so that without the funding, the people can continue doing what it's intended to be done. If not, they go back to zero and their efforts have been wasted. We talk about the where, which is the setting. The setting, we are talking about the inner setting, that's the context within the organization implementing the intervention. And it has to be in line with their cultural beliefs, their policies, their religious aspects. And then you also talk about the outer setting, where we talk about the economic resources that are used in implementing the intervention. So in essence, you just want to say that it's important for the environment to be enabling, that they have to be in support of the intervention. If not, the acceptability is going to be low. So in summary, what happens is, this is what normally happens. You have evidence-informed infection, and then you have the patient outcome. But you really do not, really cannot assess patient outcome, or usually patient outcome will be low, and you really cannot tell why patient outcomes are low. Like, why are they still suffering from the same health diseases even after a lot of research has been done? Then you have now the implementation science that comes in, that you understand what is being implemented. That's the EBI. You understand how it's being implemented, and then you understand the implementation outcomes that help you to be able to assess the implementation of your project. And we should take note that implementation is not a linear process. It doesn't go in a straight line. It can have back and forth. Sometimes you have to go back to see what is not working out, and then readjust to be able to continue. And each stage in implementation is affected by the other. If you don't use the right strategies, you will not have the right outcome. So this is the core of implementation science. So we're going to stakeholder engagement. Key parts, they're key parts when it comes to implementing an intervention, because you cannot do without them. You have to involve the stakeholders at every point. So these are individuals or organizations that have an interest or that are affected directly or indirectly by the project that is by the intervention that is being implemented. And stakeholder engagement is a process of working together with the stakeholders for a common goal. There are different ways in which you can actually engage your stakeholders. You inform, you consult, you involve, you collaborate, and you empower them. And the empowerment stage is really the biggest stage, because it's like a determinant of the sustainability of the project that you're implementing. So who is involved? We have healthcare providers, we have community members, we have program managers, we have religious leaders. Everybody that is directly or indirectly affected, or that has an interest in the implementation of the intervention, is a stakeholder. And you don't want to take anybody for granted. You don't want to say, oh, I'm just going to go to the community members, I'm not going to pass through the chiefs, or I'm just going to go to the program managers, I'm not going to pass through the community members. So everybody is affected and everybody has a role to play. So we're going to see how to engage our stakeholders. We have the non-participation engagement, where you just do outreaches, you do education, you tell them on what you want to be implementing, you tell them on the project that you want to implement. And then you have the symbolic participation, where you actually gather the community stakeholders and they're involved in the coordination meetings, they're involved in even drafting of the implementation protocol. They're involved in building the ideas. So at this point, it's relevant because you know that what you're implementing is actually a picture of what the community, or what you're going to implement is a picture of what the community needs. You don't just come with your own ideas and you expect that you're going to implement in the community and it's going to work for it. We have the example of the mosquito treated nets. You believe that these people, they have to sleep under mosquito nets to prevent malaria. But these people also have their own beliefs. They can tell that maybe at the moment the mosquito treated net is not their priority. They maybe want water, they want potable water, or they want big toilets where they can um disease and everything. So this point of engaging them in the coordination meetings enables you to actually know what they want and make sure that you're implementing an intervention that is going to be tailored to their demand. That's taking us back to the concept of demand driven. You also have cooperation, that's working together with the community members in not only in drafting but also in the implementation process. And then you have engaged participation, where both the community members and the researchers are actively involved in designing and implementation of the project and interpretation and dissemination of the findings. Then you have patient-centered, where involves mostly the group of people, like you have the patients or the caregivers and other advocacy groups that are directly related to the intervention that you're implementing. And that's the people that you work closely with. And finally, we have the community-based participatory research, that's the CBPR, which is using the population health approach to be able to come up with a patient-centered engagement model in your implementation. And it's important for you to be able to identify who to work with as a stakeholder. That's what we call the stakeholder mapping. So depending on their power and interest level, you should be able to know if you are going to involve them and at what level you are going to involve them. So those with high power, you have to satisfy them and you have to manage them closely. Those with low power, you monitor, monitor what they do, and then you just inform them. So why are we actually engaging stakeholders? Why don't we just go ahead implementing our project? As we said, it aligns with research and policy. You cannot implement a project without involvement of stakeholders, and also increases the buy-in of the ABI. If they're engaged in it, they actually tell you what they want, and it's easier for them to participate in it. It also increases transparency and it facilitates informed making decisions. So as a result of engaging as stakeholders, we can actually vouch for the relevance of the data that we've gotten through the research or the implementation process. And we also have support because they told you what they actually want. They're willing to provide the financial support, moral support, physical support, resources, and their time in making sure that the project is actually implemented effectively. It also gives room for appropriate and effective dissemination of findings and ensures effective uptake. So we have the stakeholder analysis metrics, like how do you know who to involve in a project as a stakeholder? You should be able to have the metrics. The metrics here, we're going to be using the example of the mosquito treated net, which is a famous example. So we want to name the stakeholder and at what level they are involved. That's the community members. They have to give a description of them. For the community members, our target population are the pregnant women. They are the primary beneficiaries of the project and also the end users. What is their knowledge level? We assume that they have low, and that's why they are not using it effectively. And what is their commitment level? That's very high. And what do they have to offer in terms of resources, their availability and their time? They have to be present for you to talk to them. They have to give you their time and their physical presence. And then we have community health workers. They are power health volunteers, and their role in this case is to distribute the ITNs and also to perform the educational sessions that we plan on having. Their knowledge level, because they have been to be high, and their commitment also is high because they want to achieve the desired outcome. Their time their access and their trust is what they have as available resources. So we are going to be completing for the donors as a stakeholder. That's like an assignment for us. I also want to come up with a stakeholder engagement plan. So the stakeholder engagement plan enables you to know how you're going to involve each of these stakeholders, not just knowing that they're going to be part of the project, but knowing how they are going to be part of the project, pardon. You have the community members, which are the end users. You know that the strategy is that you're going to do door-to-door meetings, you're going to do social gatherings, and also you're going to have storytellings where you tell them about the benefits of using ITNs. And you also come up with a follow-up strategy and periodic household visits, satisfaction survey, where you get them to tell you how they feel using the mosquito net. And also we're going to complete for the donors and any other stakeholder that we think can be engaged in our project. So we cannot talk about implementation science without talking about theories, models, and frameworks. So theories, models, and frameworks are the science of implementation science. That's the backbone, because you need to understand why implementation fails and why it succeeds. I'm not going to base too much on this because we are going to have an entire session that is going to take us through the implementation frameworks. But we're just going to give us an idea during this presentation. So we also want to use models because they are the factors that are able to predict the likelihood of the success of an implementation. They can tell you if an implementation succeeds or if an implementation is going to fail, because these theories, models, and frameworks are usually based from theory. Sorry, they have a lot of empirical data as backup. So because it worked in one situation, is most likely to work in another situation. And statistics say that implementations that are backed by theories, models, and frameworks have a higher chance of succeeding than just using no framework, no theory, or no model at all. So there are different models. There are different types of models that we can use depending on the type of implementation that we want. We have process models, we have determinant framework models like the constitutive framework for implementation research. We have classic theories like theory of diffusion or the societal change theory. We have implementation theories like the combine models, and we also have evaluation frameworks. So we also want to be able to differentiate between implementation research and clinical research, beginning with the aim. The reason why we conduct public health or clinical research is because we want to implement a clinical intervention, we want to promote health, we want to come up with a policy. And in conducting an implementation research, you want to be able to know how to effectively use your implementation strategy. And also the typical intervention type gives us the difference between the clinical research and the implementation research. Clinical research is mostly based on drugs, procedures, therapies, prevention programs, and you have implementation research based on practice change, training people as implementation strategies, and also based on the outcomes that we are going to be having. For implementation or clinical research, our outcomes are directly related to health outcomes. But implementation research, we have implementation outcomes which are going to be assessing. That's adoption, adherence, fidelity, as we saw. And the unit of analysis for the clinical research is the patient or the community member. But for implementation research, you cannot do it as an individual, as it's based on teamwork. You have to work together to achieve your desired goal. So some of the challenges that we face is the fact that um, evidence-based innovations are most likely to fail, even though we say yes, that EDIs, they have been proven to be effective. But why would they fail in our context? Because the implementation has been untested, incomplete, and unsuitable. Also because of the difference in the population. We should know that one size doesn't fit all. We have different populations with different needs and different settings. So we should be able to adapt our implementation into the way that is going to be context specific and suit a particular situation where we are. That's it. Also because of the sustainability of the project. Sometimes um the project ends before the project does not have the ability to go through the end. So you have a lot of people, you have a lot of projects that are being implemented, but because of the lack of funding or the cut-off of the funding, we discover that the project is no longer running. So we should be able to assess the acceptability, sustainability, and financial feasibility before engaging in a project. And also because we fail to use the theories behind the intervention. So in conclusion, we'll say that implementation science bridge the gap between research and findings because it helps us to transform what we know to what we do. It's important to use framework strategies and measurable outcomes to ensure that our interventions are effective, context-specific, and scalable. Stakeholder engagement is key in both implementation and translational sciences. Some references. Thank you.